Q&A random selection number 15. 21. Which of these parents' comments about a newborn would most likely reveal an initial finding of a suspected pyloric stenosis? A. I noticed a little lump a little above the belly button. B. The baby seems hungry all the time. C. Mild vomiting turned into vomiting that shot across the room. D. We notice irritation and spitting up immediately after feedings. 21C. Mild regurgitation or emesis that progresses to projectile vomiting is a pattern associated with pyloric stenosis as an initial finding. The other findings are present, though not immediately. 22. Which of the actions suggested to the registered nurse, RN, by the practical nurse, PN, during a planning conference for a 10-month-old infant admitted 2 hours ago with bacterial meningitis would be acceptable to add to the plan of care? A. Measure head circumference. B. Place in airborne isolation. C. Provide passive range of motion. D. Provide an over-the-crib protective top. 22A. Measure head circumference. In meningitis, assessment of neurological signs should be done frequently. Head circumference is measured because subdural effusions and obstructive hydrocephalus can develop as a complication of meningitis. The client will have already been on airborne precautions and crib top applied to the bed on admission to the unit. 23. The nurse is discussing nutritional requirements with the parents of an 18-month-old child. Which of these statements about milk consumption is correct? A. May drink as much milk as desired. B. Can have milk mixed with other foods. C. Will benefit from fat-free cow's milk. D. Should be limited to 3 to 4 cups of milk daily. 23D. Should be limited to 3 to 4 cups of milk daily. More than 32 ounces of milk a day considerably limits the intake of solid foods, resulting in a deficiency of dietary iron, as well as other nutrients. 24. A postpartum mother is unwilling to allow the father to participate in the newborn's care, although he is interested in doing so. She states, I am afraid the baby will be confused about who the mother is. Baby raising is for mothers, not fathers. The nurse's initial intervention should be what focus? A. Discuss with the mother sharing parenting responsibilities. B. Set time aside to get the mother to express her feelings and concerns. C. Arrange for the parents to attend infant care classes. D. Talk with the father and help him accept the wife's decision. 24B. Set time aside to get the mother to express her feelings and concerns. Non-judgmental support for expressed feelings may lead to resolution of competitive feelings in a new family. Cultural influences may also be clarified. 25. The nurse is talking with a client. The client abruptly says to the nurse, "The moon is full. Astronauts walk on the moon. Walking is a good health habit." The client's remarks most likely indicate A. Neologisms. B. Flight of ideas. C. Loose associations. D. Word salad. 25C. Loose associations. Though the client's statements are not typical of logical communication, remarks 2 and 3 contain elements of the preceding sentence, moon, walk. Option A refers to making up words that have personal meaning to the client, and option B, flight of ideas, defines nearly continuous flow of speech, jumping from one unconnected topic to another. Option D, word salad, refers to stringing together real words into nonsense sentences that have no meaning for the listener. 26. A mother asks about expected motor skills for a 3-year-old child. Which of the following would the nurse emphasize as normal at this age? A. Jumping rope. B. Tying shoelaces. C. Riding a tricycle. D. Playing hopscotch. 26C. Coordination is gained through large muscle use. A child of 3 has the ability to ride a tricycle. 27. The nurse is monitoring the contractions of a woman in labor. A contraction is recorded as beginning at 10 a.m. and ending at 10:01 a.m. Another begins at 10:15 a.m. What is the frequency of the contractions? A. 14 minutes. B. 10 minutes. C. 15 minutes. D. 9 minutes. 27C. Frequency is the time from the beginning of one contraction to the beginning of the next contraction. 28. A client who has been drinking for 5 years states that he drinks when he gets upset about things such as being unemployed or feeling like life is not leading anywhere. The nurse understands that the client is using alcohol as a way to deal with A. Recreational and social needs. B. Feelings of anger. C. Life stressors. D. Issues of guilt and disappointment. 28C. Life stressors. Alcohol is used by some people to manage anxiety and stress. The overall intent is to decrease negative feelings and increase positive feelings, but substance abuse itself eventually increases negative feelings. 29. The nurse is preparing a 5-year-old for a scheduled tonsillectomy and adenoidectomy. The parents are anxious and concerned about the child's reaction to impending surgery. Which nursing intervention would best prepare the child? A. Introduce the child to all staff the day before surgery. B. Explain the surgery 1 week prior to the procedure. C. Arrange a tour of the operating and recovery rooms. D. Encourage the child to bring a favorite toy to the hospital. 29B. Explain the surgery 1 week prior to the procedure. A 5-year-old can understand the surgery and should be prepared well before the procedure. Most of these procedures are same-day surgeries and do not require an overnight stay. 30. The nurse should recognize that physical dependence is accompanied by what findings when alcohol consumption is first reduced or ended? A. Seizures. B. Withdrawal. C. Craving. D. Marked tolerance. 30B. The early signs of alcohol withdrawal develop within a few hours after cessation or reduction of alcohol intake. Seizure activity is one withdrawal symptom, but there are many others, like nausea and tremor. 31. The client who is receiving enteral nutrition through a gastrostomy tube has had 4 diarrhea stools in the past 24 hours. The nurse should A. Review the medications the client is receiving. B. Increase the formula infusion rate. C. Increase the amount of water used to flush the tube. D. Attach a rectal bag to protect the skin. 31A. Review the medications the client is receiving. Antibiotics and medications containing sorbitol may induce diarrhea. 32. The nurse, assisting in applying a cast to a client with a broken arm, knows that the cast material should be dipped several times into the warm water. B. Cast should be covered until it dries. C. Wet cast should be handled with the palms of hands. D. Casted extremity should be placed on a cloth-covered surface. 32C. Wet cast should be handled with the palms of hands. Handle cast with palms of the hands and lift at 2 points of the extremity. This will prevent stress at the injury site and pressure areas on the cast. 33. In taking the history of a pregnant woman, which of the following would the nurse recognize as the primary contraindication for breastfeeding? A. Age 40 years. B. Lactose intolerance. C. Family history of breast cancer. D. Use of cocaine on weekends. 33D. Use of cocaine on weekends. Binge use of cocaine can be just as harmful to the breastfed newborn as regular use. 34. Immediately following an acute battering incident in a violent relationship, the batterer may respond to the partner's injuries by A. Seeking medical help for the victim's injuries. B. Minimizing the episode and underestimating the victim's injuries. C. Contacting a close friend and asking for help. D. Being very remorseful and assisting the victim with medical care. 34B. Many batterers lack an understanding of the effects of their behavior on the victim and use excessive minimization and denial. 35. A client with emphysema visits the clinic. While teaching about proper nutrition, the nurse should emphasize that the client should A. Eat foods high in sodium to increase sputum liquefaction. B. Use oxygen during meals to improve gas exchange. C. Perform exercise after respiratory therapy to enhance appetite. D. Cleanse the mouth of dried secretions to reduce risk of infection. 35B. Use oxygen during meals to improve gas exchange. Clients with emphysema breathe easier when using oxygen while eating. 36. A victim of domestic violence tells the batterer she needs a little time away. How would the nurse expect that the batterer might respond? A. With acceptance and views the victim's comment as an indication that their marriage is in trouble. B. With fear of rejection, causing increased rage toward the victim. C. With a new commitment to seek counseling to assist with their marital problems. D. With relief and welcomes the separation as a means to have some personal time. 36B. The fear of rejection, abandonment, and loss only serve to increase the batterer's rage at the partner. 37. An 18-month-old has been brought to the emergency room with irritability, lethargy over 2 days, dry skin, and increased pulse. Based upon the evaluation of these initial findings, the nurse would assess the child for additional findings of A. Septicemia. B. Dehydration. C. Hypokalemia. D. Hypercalcemia. 37B. Dehydration. Clinical findings of dehydration include lethargy, irritability, dry skin, and increased pulse. 38. The nurse prepares for a Denver screening of a 3-year-old child in the clinic. The mother asks the nurse to explain the purpose of the test. What is the nurse's best response about the purpose of the Denver? A. It measures a child's intelligence. B. It assesses a child's development. C. It evaluates psychological responses. D. It helps to determine problems. 38B. The Denver Developmental Test 2 is a screening test to assess children from birth through 6 years in personal/social, fine motor adaptive, language and gross motor development. A child experiences the fun of play during the test. 39. The nurse is caring for a toddler with atopic dermatitis. The nurse should instruct the parents to A. Dress the child warmly to avoid chilling. B. Keep the child away from other children for the duration of the rash. C. Clean the affected areas with tepid water and detergent. D. Wrap the child's hand in mittens or socks to prevent scratching. 39D. Wrap the child's hand in mittens or socks to prevent scratching. A toddler with atopic dermatitis needs to have fingernails cut short and covered so the child will not be able to scratch the skin lesions, thereby causing new lesions and possibly a secondary infection. 40. The father of an 8-month-old infant asks the nurse if his child's vocalizations are normal for his age. Which of the following would the nurse expect at this age? A. Cooing. B. Imitation of sounds. C. Throaty sounds. D. Laughter. 40B. Imitation of sounds such as dida is expected at this time.